I will invite Charles Rotrammel to come say a word.
All right, we have quite a treat tonight, and I'm the IT camera guy, so if I'm a bit distracted, sorry. We're trying to record this so that we can put it up online for volunteers that could not be here tonight. So, special request. So it's my great privilege to introduce Dr. Gerri Hanten from Baylor College of Medicine. Gerri and I have been friends for a long time, and she has been doing great work studying our kids. And so she's going to talk about a new grant that Baylor has received and some things that relate very directly to your work. So thanks for coming.
Thank you, Charles. I've been instructed to speak directly into this microphone. So if I start, I'm a very active speaker, so if I start waving it around like this, just bring me back on track. I first of all just want to add my thanks to all the great work you all are doing. We're very impressed and appreciative of the work you're doing with these children. It's very, very important work. I'm happy to say that the Department of Justice thinks so as well. And as a consequence, we got a nice grant from them to study this program. Charles, how do I make this go?
I'll do it for you.
Oh, okay. Ooh, this is really getting my control thing, you know? So I wanted to take the opportunity tonight to tell you a little bit about this study, what our goals are for the study, but especially I want to talk a little bit about what your role in it is. The goals of the overall study are several, but there are two very big ones that I'm going to talk about. The first aim that we had was to, of course, document the efficacy of the reVision program. This is important for several reasons. First of all, the Office of Juvenile Justice, their main goal is to reduce recidivism. And the way to do that, of course, is to find programs that work. And that's one of our goals here. The outcome measures for that are twofold. Generally, people only look at recidivism. That's sort of focusing on the negative when a program fails. What we thought about in conversations with Charles and Jean, we realized that one of the things we wanted to look at was not just when something fails, but when it works, because those two things can happen at the same time. They are not mutually exclusive. Okay, so this is like probably the primary goal for the program, but we also wanted to look at specific factors that will tell us more about why the intervention might work for some people and not for others. Now, we all know that interventions are rarely, if ever, 100% effective, but we don't know why necessarily. So we have built into this grant a number of measures that will allow us to look at different factors and how they might relate to whether or not a youth responds to the intervention. This is important because it allows for targeted intervention. This is critically important because resources are limited and we need to put money where it can be best used. It's also important because this gives us information about what isn't working or what areas might point us in another direction to help those kids who are not responding. So that's also critically important. So those are the two main study goals. Okay. I'm not going to talk about this for very long because it's a little boring, but I wanted to just give you an idea of what the design of the study is. It's what we call prospective longitudinal design. That means that we enroll a youth when they're first incarcerated, and from that moment on, we follow them for a while. We do a bunch of measures at what we call baseline when we first meet them, and then we see how those change at different time points. Okay, so that's our prospective longitudinal design. Of course, we have to have something to compare them to, and in our case, we have two ways of doing that. We have a control group, which is not which aren't kids who are in revision, but they're also kids who are involved in the juvenile justice system. These are youth who are very much like the kids who are in revision, but they don't have the advantage of being in revision. We have access to this data through the wonderful cooperation of the Harris County Juvenile Probation Department. But as I mentioned before, this kind of analysis focuses on the kind of negative consequences. We have no way of tracking those particular kids, their pro-social behavior or anything positive. We only can see when they have failed or when they commit another crime. But because we're interested in the positive, we also found a way to look at positive change. And you'll actually see a little bit of how we were doing this tonight in the application that Charles will be showing you. So what we'll also be looking at is how these youth change over time. That will allow us to see when they make a positive change. So we compare the measures, their measure at baseline to how they are about a year later. Okay, so that's called a within subjects design. Our approach is based on a large literature called Readiness for Change. So this is a literature that was initially started to describe changes that occur in people who are trying to, I believe it was for substance abuse, people who are trying to change their habits in substance abuse. But it has turned out to be extremely robust concept, and it describes many different ways that different types of behavioral change. So the basic idea is that change does not happen usually does not happen as a single event. It is a change over time. And the change can happen in very specific steps. These changes involve both cognitive, like rational thinking, and emotional processes. As I said, it's a very strong predictor of behavioral change, but nobody has yet applied it to this population. We think that it may be very helpful for us to know about this, because one of the things we've learned about any kind of behavioral change is that different kind of information or different kind of suggestions are received in different ways depending on what stage of change a person is in. Next slide. So this is what the stages of change are. Are you all familiar with this? Not yet? Okay. So the stages of change are described variously as between 4 and 6 changes, but really there are 4 basic ones, and they are pre-contemplation, contemplation, action, and maintenance. These actually can be measured, and we have a different instrument to do that. The pre-contemplation stage is the situation where there is no plans for change. The person may not even recognize the need for change, or if they do recognize it, they're not admitting it. It can also be, though, that they have tried to change and have been so discouraged that they are resistant, so they're kind of showing emotional numbing or withdrawal. So that's the pre-contemplative stage. Contemplation is when they're actually at the point where they will consider the need for change. This is sometimes accompanied by, frequently accompanied by the idea that they are weighing the pros and the cons of change. So they'll be very aware of the advantages of change, but they'll also be extremely aware of the disadvantages, because what they know is more comfortable than what they're moving to. Change is hard for everyone, right? It's hard to go from what you know, even if what you know doesn't feel so great all the time. So this is characterized by people kind of flopping back and forth. And this is one of the points where the kind of information they get is really important. The third stage is the action stage, and this is where people have actually become committed to make a change, and they start doing things, making changes in the environment, or maybe even in the way they talk, the way they act, that is shows their forward momentum, so they are ready for a change. At this point, they are open to many kinds of suggestion about how to do that. One kind of interesting thing is if you look through the literature on any kind of behavioral change program or intervention, most of these programs are aimed at the action stage. This might be why many of them do not work, because many people may not be quite there. So this is kind of the, maybe one of the bases why one size fits all does not work. So the final stage is the maintenance stage. Once you get there, you pretty much have it made. Now, it's not the case that there won't be backsliding. There will be. But the action is clear, there's commitment, and this is just a matter of keeping up what they have already accomplished. So those are the 4 stages. Okay, now I'm going to focus on 2 of the study questions that we have, and I'm going to run through these really quickly. I'm sorry if this is taking a little bit longer than I thought. But so I've already alluded to the first 2 questions. These first, well, they're not first 2, but the highlighted ones that are the most important. One is, the first question is, does the reVision program reduce recidivism and promote pro-social change? So that's the big one. But the other one that is really important to us, and we're beginning to see how important this might be, is what the role of the mentors are in affecting this change. We'll also be looking at a few other questions. We want to know what are the stage of change that these youth are in when they actually enter the program. Are they all at the same stage, like denial? Or are some of them already kind of coming along like, uh-oh, I need to do something here? We want to see what the trajectory of change is. We want to see how fast they change over time. And we'll do that by looking at them and doing some tests on them at 3, 6, and 12 months. We want to know what individual factors might affect their change. So we'll be looking at things like their personality, measures of self-efficacy, their IQ, their cognitive abilities, which can vary greatly from each other. And also their psychiatric status, which probably has a huge effect. We also would like to know what environmental moderators might affect change, and those are the things like their family, their neighborhood, their social networking. We think that this has probably got a huge effect. But for tonight, what I really want to talk a little bit more about is the effect of your mentors. Now, it turns out that there is very, very little known about the influence of mentors on outcomes of these kids. There has been some research done on mentor-mentee relationships, but most of that work is carried out in the areas of business, so business mentoring, or in academics, educational mentoring. Very, very little has been done in youth offender population, if anything. Actually, there's been a little bit. But it has at least been recognized that this could be tremendously important. You mentors may be the most stable adult in these young kids' lives at this point, so you can have a very large influence. And what we're coming to realize is that you may even have a greater influence than we realized, because many of these kids, a huge proportion of these kids, have post-traumatic stress disorder. We have discovered this in some studies that I've done with Charles before. And it turns out that one of the things that research has shown is that there is a very large and very positive effect of having a mentor or let's just say emotional support very quickly after the traumatic event. In this case, there's going to be pretty big trauma associated with being arrested and that sort of thing. So having this emotional support early on and consistently could make a very, very big difference in these kids' lives. Okay, so now I just want to tell you a little bit about what we would like to measure from the mentors. Basically, we have 6 different measures we're going to do. I should say that we actually, in this grant, we started out with a lot smaller role, but as we've gone through it and as we've more information has come in, we've realized that we needed to expand our research to find out a little bit more about the mentor-mentee relationship, because we think it's going to be very important. So one of the things we're going to look at is, so the youth are also going to get some of these measures. And the first one is the measures of the impact of the relationship on the youth. For these, we'll be getting measures of personality. We'll also get an attitudinal scale. These are all the youth's attitude, okay, and the youth's personality. And then there is a scale called a mentor-mentee alliance scale, and that is basically how the youth feels about their mentor, all right? We also are going to get these very same measures to the mentors, because we want to see what the overlap is, or if there is discordance, or if complementary, for example, complementary personalities might be better, or they might not be. We don't know. No one knows. So those are the scales that are going to be given to both the mentors and the mentees. We'll also be giving measures that are specifically measures of impact on the mentor. There's one that's called locus of control. This is a very interesting measure about what ultimately ends up being the mentor's impact on the youth. Now, this was originated in the business world, so we don't know if it's going to transfer here, but it makes sense. And this is the idea of whether or not a person gives the idea that the control of their life is determined by outside events or internal events. So we think this will be very interesting. We'd like to know the cost-benefit from your point of view of mentoring, and so we have a scale on that. And then we're also going to just have an open-ended interview where we would like to hear your thoughts on mentoring. So those are the measures that we would like, those are the data we'd like to collect. This is important to us because we know that the mentoring experience is not a one-way street. This is not all about the kids. Some of it is about you all too. One reason it is very important is because for programs like this to be sustainable, everyone has to benefit in some way. So if it is all a negative situation that you are putting out energy and not getting anything back, it is not going to be sustainable. So this is why we're really interested in finding out about this. Okay, I think. Okay, so basically I am making a pitch for you all to agree to participate, or I'm inviting you to participate. And so let me tell you what's involved. Basically, it would take around 30 minutes of your time to fill out the different questionnaires. We will have a sign-up sheet. We actually have some information sheets that we'd like to pass around, and if you're interested, you can fill them out and give them back to us. Once you give us a sign-up sheet or you've indicated your interest, one of the research assistants will give you a call, probably our research coordinator, whose name is Jackie Duran. And you will tell her your scheduling preferences. We have gotten some great feedback from some of the mentors who have already participated. And one of the things that did come up was that some people prefer to have time to fill out these forms alone, not with somebody sitting there, watching them. And so we are happy to send out the questionnaires by email to everyone. We will still have to meet you in person because we have to get an actual written consent. We have to see that you actually signed it. And so we will send out these forms if you're interested, and with instructions how to send them out, and of course information about how to contact us if you have any questions. So the forms can be filled out either before that you have your interview with us, or if you just want to look them over and fill them out once you get to the interview, that's fine too. The important thing here I wanted to mention is, I mentioned the consent form, but also I wanted to assure you that all information that we gather from you is very strictly confidential. This is not only our inclination, it is law. We go through very rigorous training on confidentiality. Your name will never appear on the forms, so if you decide to participate and we send you these forms, please do not put your names on them. When we see you, we will give you an ID number, and that ID number can eventually be linked to your name, but only through me. I'm the only person that will know the link up there. That is important because we do want to see what your link is to your mentee. And they also have an ID number, so we'll be linking those two ID numbers, but your name will not appear. No data will be published using anyone's name or any kind of information that can be traced back to them. The only data that we'll talk about will be means and averages and things like that where no individual stands out. So that's all I have to say. Any questions about this? Yes.
So,
Sir.
me?
Yes.
I'm just thinking about my mentee as you're giving the presentation. And I'm thinking there's probably more than one thing that needs to change to get reduction in recidivism.
Yeah.
Like, for example, to get out of the gang he was in, and that's easy to do when you're incarcerated.
Right.